The Self-Care Learning and Discovery Series is back, and it's bigger and bolder than ever. This is the premier self-care event of the year, bringing together self-care enthusiasts of all backgrounds and disciplines from around the world. The World Health Organization defines self-care as the ability of individuals, families, and communities to promote health, prevent disease, maintain health, and to cope with illness and disability with or without the support of a healthcare provider. We also know that self-care means different things to different people. What does self-care mean to you? You'll have ample opportunity to reflect on this question during the Discovery Series, with more than 20 interactive virtual sessions organized by self-care experts worldwide. The Discovery Series will elevate cutting-edge research, programming, and advocacy insights across a wide variety of self-care topics, and we encourage you to attend as many sessions as possible, especially on topics that may be new to you. The Self-Care Learning and Discovery Series, a core activity of the Self-Care Trailblazer Group, is organized by the White Ribbon Alliance in partnership with co-sponsor organizations and esteemed steering committee members. We also want to thank all our session organizers and presenters who have voluntarily dedicated their time to curate this event with us. We are pleased to share that every session will offer live, simultaneous interpretation in French, Spanish, and English. To access the interpretation, simply navigate to your meeting controls located at the bottom of your screen. Click on the globe icon labeled Interpretation and select the language you'd like to hear. Joining from your phone, tap on the ellipses to find the interpretation feature and then select your language. Please note, you can switch languages at any time throughout the presentation. The session is now about to begin. Don't forget, whether you're working to influence policies or programs, advance universal health coverage, or improve your own self-care, we hope that you will take the learnings from today's discussion and apply it to your own work. To that end, we invite you to continue the conversation and take action with us by becoming a member of the Self-Care Trailblazer Group. So get curious, jump in, and share your ideas and insights with us. We look forward to advancing self-care together.
Hello, everyone. Welcome, welcome to today's session. I hope you're excited as I am. And so thank you so much. And that has been one of the short introductory video about how we are going to proceed with today's session, from a UN political declaration to country implementation, how to ensure universal health coverage, global commitments lead to the scaling up of self-care. So before we start the conversation today, please make sure to let us know where you are watching us from. Do having your name in the chat box and your country and send a hello so that we can understand the dynamics of the geographical location of who is our viewer today, and sure we are going to proceed smoothly with the conversation. So, just a brief introduction, and, although self-care was not included in the 2023 Universal Health Coverage Political Declarations, it contains important commitments relevant to young people and their access to healthcare. So this session will highlight concrete actions advocates can take to strengthen self-care initiatives in country and how to use the Universal Health Political Declaration as an advocacy tool. So through this session, we aim to improve the understanding of self-care as an undeniable area of universal health coverage, to improve understanding of the universal health coverage high-level meeting process and the political declaration, and finally to discuss how young people and civil society can use the political declaration to hold their governments accountable to improve self-care and universal health coverage. My name is Joel Okeyo, and I'm going to be your host for today. And, just to send a big shout out or a big thank you to AIDS Funds, to Y Plus Global, to Youth Care Partnerships and Self-Care Trailblazer Groups for bringing you this conversation today. So, we're going also to be having a small chat bot Yes, I hope I said the name correctly, chatbot. I do forget it from time to time. And yeah, we're going to be having questions for you in the chat board. So please be sure to also engage with us so that we can be able to move swiftly and move together. And, I'm already seeing guys in the chat board. So allow me to just read a little bit of your introductions. We have viewers from Amsterdam. We have viewers from Delhi in India, from Belgium, from India again, we have from Nepal, we have from Zambia. Hi, guys, keep them coming in, and thank you so much for joining us today. And we're going to jump right into the conversation. So, without wasting much time, we do have a short video presentation for you as well, for just an introductory video. Okay, and then we can proceed into the conversation as I welcome Priscilla. But for now, we're going to have a video. Thank you.
It's important to scale up self-care services to young people as it helps them understand their health requirements and help them know that they have the choice to choose whether to get services or not and where to access their services for their well-being. So in South Sudan, there are youth-friendly corners that have youth-friendly service providers that assist young people in services and information on relevant health aspects, including sexual reproductive health and rights. And that really helps young people to understand their sexual reproductive health rights and know that they have the rights to access certain services without really being questioned on why they should access certain services. So that it really improves on the self-care and the well-being of young people. Looking at the universal healthcare coverage meeting, I would like the government to commit on implementing the already made commitments on health to ensure that every person within the community has access to affordable and quality healthcare services, and also ensure they prioritize environmental and climate change factors that could easily disrupt the healthcare services.
Fantastic. That has been one of the amazing videos that we have used, that we used to champion for universal health coverage for young people globally. And yes, so if you're joining us today, welcome to, today's session when we're talking about, from a UN political declaration to country implementation, how to ensure that universal health coverage, global commitments lead to the scaling up of self-care. And with me, I do have the beautiful Priscilla Ama-Adu, a really good friend of mine. So, Priscilla, thank you so much for joining us today. And give us a little bit of your presentation. I know you have prepared something for us. So thank you so much, Priscilla. And now the floor is yours, guys. Remember, you can also ask your questions in the chat box. We are going to get to them as we progress with the conversation, as well as let us know where you are watching us from. Do send your name and do have, your country so that we can get the geographical location of where you are watching us from. Thank you so much. And Priscilla, the floor is yours.
Thank you very much, Ruel. I hope I'm loud and clear. Thank you very much, 8Months, for giving me the opportunity to lead on this session. To begin with, I think it's very important that we understand what UHC HLM is all about and why it is important. So the universal healthcare coverage, essentially what its main purpose is to ensure that people everywhere get access to quality healthcare services regardless of their financial situation. So regardless of your financial situation, whether you are going through financial hardship, you should be able to access quality healthcare services. That is what UHC or universal health coverage is all about. And this is really important because it is also key in attaining the sustainable development goals. When it comes to looking at the humanitarian crisis, the climate crisis, the video we just watched mentioned environmental crisis as well. So UHC is really, really important. And also it is based on principles of equity, non-discrimination, and the right to health, especially for marginalized populations, as they are mostly the ones that are left behind. So UHC is essentially ensuring that no one is left behind when it comes to accessing quality healthcare services. Now, at the high-level meeting in September this year, the global community, stakeholders, political powers all came together to renew their commitment to achieving UHC. Worldwide, they convened at New York to do this. And it's really, how would I like to say this, but it was really sad to see that self-care did not make its way into the final political declaration. And we can chalk this down mainly because it's still a new concept and people do not quite understand it. And there are even myths or misunderstanding or misconceptions that self-care is coming in to replace actual healthcare services, which is not true. Now, why is self-care important, or what is the interconnection between universal health coverage and self-care? We want to know, I want everyone to know that it plays a huge role. They are very, very much interconnected. Universal healthcare coverage and self-care are very much interconnected, because when young people learn how to practice self-care, or they know how to ensure that they give themselves the quality healthcare services that they can attain or that they need at the moment, healthcare resources can be more allocated efficiently to those who most need it. And looking at our healthcare systems at the moment, we can all say, or we know that it is very, very hugely burdened and underfunded. So self-care coming in is actually coming in to ensure or see to it that we achieve universal healthcare coverage for people, especially for those who cannot afford it. Self-care bridges the gaps when it comes to accessing care, and it fosters interdependence. So you are able to learn and you're able to take care of yourself. You know your needs, you know what you need at this time because you've been educated on it. You don't always need to depend on someone to ensure that your health needs are met. That's overall improving the quality of life. So achieving UHC, or ensuring that universal healthcare coverage comes into play or actually actualizes itself, it cannot be done alone. So this is something that we must all come together to ensure that it is realized. Now, I want us to go into the key commitments that were agreed on in the political declaration. So the declaration mentions significant themes or commitments, such as leaving no one behind and critical barriers, strengthening healthcare services or systems, ensuring that healthcare systems are able to function correctly, especially including reaching out to vulnerable people, ensuring they have affordable, accessible, and available healthcare services, especially throughout the rural areas. Then there's the SRHR and access to information. Then there's the digital health interventions. Then there's monitoring and evaluation and governance. So these are all crucial commitments that were made in the declaration. And as I said before, self-care was not included, and we can attribute that to the inadequate information and the understanding of its importance. So from some of you who may be joining us today, maybe you've heard of self-care before, or this may be the first time that you've heard it before. So you would not understand why it needs, or it should have been included in the political declaration, because self-care essentially can ride on the back of digital health intervention, seeing as now digital solutions are all we know about. The phone you are holding is a huge resource to providing you with accurate healthcare information if you know where to look. So self-care can essentially help us ensure that we leave no one behind. It will also ensure that we strengthen our healthcare systems and ensure that SRHR and access to information is easy. So essentially, if self-care was to be included in this, we would have realized that it's interconnected with all these various themes we are seeing here. So it's quite a shame again that it didn't make it in here, but it's also really important to know that we can still leverage on these commitments. So despite that self-care may not have been included here, we can still leverage on it. Digital health interventions, we can still leverage on that to ensure that we provide self-care solutions or digital self-care solutions to people, or to our young people and to our communities. So there are still many ways that we can promote self-care through this, these commitments, and it's all about identifying avenues for advocacy, partnerships, and collaborations. Now, I would like to bring everyone's attention to the youth statement that was created by young people during the high-level meeting. This was in September when the declaration was still going through its final processes. So when we saw the draft of the political declaration and we realized that there were a lot of things that were missing, or there were a lot of gaps that were not being addressed in this political declaration, Y+ Global, alongside other young advocates from across the globe, came together to create the youth statement, where they outline their priorities, looking at what the UHC currently has and what it's lacking. So this statement was developed in response to the omission of self-care from the draft, and it was a webinar that was organized prior to the UHC declaration to encourage young people to follow the proceedings as well of the HLM and hold their leaders accountable to the UHC commitments they made. So the statement, I hope it will be shared in the chat box, because it's a really important resource, because the statement actually also opened my eyes to what are the barriers within our communities, the youthful population and the youthful communities. So it reviewed the existing gaps that young people face when accessing health services, such as unaffordable healthcare services, stigma and discrimination, legal barriers, harmful cultural practices, social norms, religious laws, among others. So these are gaps that we noticed were not significantly mentioned in the commitments, and we brought them up, or we stated them out in this youth statement. And we are saying that it is not just about stating the problem, okay, these are the issues, these are the gaps, but what can we also do as well? So the statement also mentions that we as young people need to be committed to scaling up our efforts when it comes to advocacy, active youth leadership in advancing self-care and SRHR, and to achieve universal health coverage for young people. So we also stayed committed, or we also showed our commitments that we are still going to continue our advocacy, especially through programs or initiatives like Youth Care, Youth Lead, the Ready, and all other youth engagements or youth platforms that have been co-created and created by young people. So we did not just point out the gaps in the political declaration. We also brought up solutions or commitments that young people must make and stand on as way of an action to demonstrate their youth leadership. So I would like to end, I would not like to take up your time, but I would like to end here by saying that self-care not making its way to UHC is not a dead end, or it's not a means to lose hope, but it's rather we should rather see it as a form of motivation, or a form of encouragement that we can still leverage on the commitments to hold our leaders accountable, to continue preaching about the existence of self-care, and actually make known the benefits of self-care, that we are truly seeing it in ourselves. Like when we encourage young people, especially young people living with HIV, when we create a community, when we send reminder messages for adherence, and when we ensure that we support young adolescent girls and young women to access the SRHR services they need without the need of feeling stigmatized or discriminated against in any way, it is crucial, because it helps in ensuring that at the end of the day, we are achieving what UHC is all about. And it is all about identifying the avenues we can make these advocacy acts, who we can partner with, who we can collaborate with. So we should not see this as a setback in any way, but as an opportunity to continue making our voices heard, and ensuring that we advocate through the meaningful ways, or ways that we can be heard as much as possible. So let's not think that we need a huge platform to make this known. No, we already own platforms that we can make it known already. And by that, I mean the social media platforms that we already are on, that we already own. Many of us own a huge platform, and we can use this to advocate meaningfully for the need of self-care, especially in UHC, and for our government and for our political leaders to recognize it and stand on that commitment. Thank you very much, Ruel.
Thank you so much, Priscilla. And that has been very extensive. And congratulations to Y Plus Global for creating such a powerful youth statement, which, by the way, if you're just joining us, is attached in the chat box. So you can be able to see there and engage with the document as you proceed. And now, as we're moving forward, I would love to introduce a poll question, right? We're going to have a poll question, and thank you so much for the presentation, Priscilla, because that is going to lead to. So the poll question on your screen is, what do you believe are the key benefits of universal health coverage? And you can only make a single choice. So is it A, improved healthcare access for all, financial protection for individuals and families, reduced healthcare disparities, improved public health outcomes, or other? So do share your thoughts and feedback in regard to the poll question that is on your screen. And we're going to be moving swiftly. Yes, so it's a single choice question, so you can only be able to have one. What do you believe are the key benefits of universal health coverage? So you can be able to choose from any of the options that are on your screen, or you can also be able to choose other and submit it. I'm gonna pick mine and done. Yeah. Yes. So also, if you're joining us, please be sure to tell us where it is you're watching us from. I am seeing we have people joining from Zambia, we have people joining from India, we have people joining from Amsterdam. So please do let us know where you are watching us from. We do have Cameroon as well. We have Kenya also represented in the room. So as we are moving swiftly, I'm not the one talking, I'm talking so much. But yeah, I do have with me a panel of guests who are going to take us through understanding healthcare. Yes, the presentations are going to be shared after the session. So yes, they're going to be shared. You're going to get them. Although for the youth statement is attached in the link in the chat box, you can get it in the chat box for the Y Plus Global Youth Statement that was presented at the high-level meeting. We do have Malawi represented in the house as well. So there are the poll answers that we have received. We have improved healthcare access for all, taking 68%. We have financial protection for individuals and families, which has 0%, reduced healthcare disparities at 16%, and improved public health outcomes at 16%. Thank you so much for sharing your thoughts and opinions about universal health coverage. So now, as we are moving on forward, I would want to introduce my guests, panel guests. I have another question for you, but it's going to come a little bit later, okay? So we have one Kumbu, who's a really good friend of mine. We have Elena, and we do have Priscilla as well. So I am going to let each and every one of my panelists or my speakers unmute, tell us a little bit more about who they are, what they do, where they're from, and then we're going to jump right into the conversation. So the gentleman in me is going to say ladies first. Elena, could you take the stand?
All right. Thank you very much. It's really a pleasure to be part of this conversation. I'm really excited. My name is Erina Masinga. I'm from Malawi. So I'm the national coordinator for the National Association for Young People Living with HIV. Thank you. Over.
Awesome. Awesome. Thank you so much. Priscilla, we're back to you.
Okay, so I'm now introducing myself. My name is Priscilla Ama-Ado. Hold on a second. Yeah. So I am from Ghana. I work with Y Plus Global as the Comms and Advocacy Graduate Trainee. But in Ghana as well, I'm the president for the National Network of Young People Living with HIV in Ghana. Yeah. Thank you.
Thank you so much. One Kumbu. Hi, friends.
Hi, Luel. Hi, everyone. I'm happy to be here. My name is Wankum Simkonda, and I'm a district coordinator working for an organization, a youth-led, Copperos Zambia, an NGO which is based here back home. So I'm excited to be here. and sharing my insights on this panel discussion with Elena, Priscilla, and everyone joining on this call.
All right, thank you so much, Nkumbu. And we're just going to start with a conversation. And while we do have Elena, could you be able to let us know, why does self-care matter for us to achieve universal health coverage? Oh, sorry.
All right, thank you very much, Ro. I think for a long time we have dealt with various challenges in terms of illnesses, for example, and epidemics, I should say. So we looked at issues of HIV and we looked at issues of sexual reproductive health. And for a long time, we've been looking for solutions, and we're talking about innovative and sustainable solutions that include self-care and UHC. So I believe that self-care provides a foundation and actually a benchmark to resolving all the healthy issues affecting young people and all people in general. Therefore, it is very important to incorporate it into our healthy systems and making sure that it is adopted. And I think we kind of underestimate self-care, because this is about giving power to people to actually advocate and take care of their own health. And by the end of the day, it's not only helping in terms of the healthy sector, but it's going to help us in general as countries. So I believe self-care provides a solution to a lot of things, and we're giving voices to people. And when you talk about leaving no one behind, I believe that self-care provides that kind of power, and it is a catalyst to achieving universal health coverage. So self-care should be influenced at all levels, individual level, community level, as well as at the national level. So we need to lower the burden on the healthy system and reduce healthy costs. And for me, self-care is what matters in ensuring that all this is achieved. Yeah, thank you.
All right. Thank you so much, Elena. And while I still have you, if we could proceed a bit slowly so that we can also create room. I would also wish for you to explain to us, what are some of the self-care priorities for young people in your context?
All right. Thank you. So I think we look a lot at information is power, knowledge is power. So empowerment of people, especially young people, on knowledge about sexual reproductive health, self-care, and UHC is very critical for us to achieve the national and global objectives that we want to see. So I believe embedding self-care training as a core component on education, health, and social care would be very vital. I think we can even study it at all level. You can study it in schools by embedding it in our curriculum. I believe a lot of countries have got a component of sexual reproductive health. For Malawi example, we've got life skills. So embedding self-care in life skills, whereby we're empowering the younger generation at a younger age, as well as incorporating it in our healthy care service trainings in healthy schools, making sure that already service providers are aware of self-care and universal health coverage area on, to ensure that I think we are involving everyone as we go along. And we're also looking at access to quality SRHR and HIV services. So many healthy facilities are not adequately equipped to provide services based on many underlying factors. So we're looking at even distribution of drugs. And recently, I'm very excited that AIDS Funds conducted a desk review in Malawi in terms of the availability of HIV self-testing kits. And one of the key issues that came up was young people cannot access the HIV self-testing kits due to issues of stockouts. But this is a need. And if you look at self-testing kits, is another item that supports self-care, in achieving self-care. So ensuring that there's access to quality services and commodities for young people is a very key priority to look at as we're improving self-care. As well as we're looking at improving improving policy environment and political environment for young people. There are a lot of policies that impede young people's well-being to fully attend their sexual reproductive health rights, as well as practice self-care. We're looking at the LGBTI communities. They face a lot of challenges in accessing services, and there are a lot of factors that keep affecting young people from accessing these services. We are talking about the abortion bill in Malawi. We're still keeping this conversation and years are going. We're talking about 2030 agenda, but we're still having policies that are impeding access and the human rights for the young people. So integrating all this and finding key interventions, innovative interventions that put self-care at the center is very critical to ensuring that at least we're moving towards sustainability and ensuring that everyone has access, equal access to healthy care services. Yeah, thank you.
Thank you so much, Elena. And you know, with your thoughts and your opinion on what self-care matters to us and what some of the priorities that you've mentioned are, I'm going to have to now bring into the audience the second poll question that we have. And before we proceed, we just want to what role should governments play in achieving universal health coverage? Based on what Elena has mentioned or your understanding of self-care, your opinion, what role should play in achieving universal health coverage? That's the second poll question that we have. So again, in your opinion, what role should governments play in achieving universal health coverage? Should governments be the primary provider of healthcare services? Governments should regulate and subsidize healthcare services. Governments should facilitate access but rely on private providers, or governments should have no role in healthcare. So which answer do you feel the role that government should play in achieving healthcare coverage? And I am submitted my result. It's a single answer, single choice, single option. Yeah, right. So in a short while, we are going to get the answers. So we are now going to reel in Wankumbu. Hi, friend.
Hello.
Right. So I hope you voted, right? Because we already have the polls back. And we have government should be the primary. Oh, okay. Yeah. The question goes went, but we're going to get back to it. Oh, fantastic. The government should be the primary provider of healthcare services at 47, and government should regulate and subsidize healthcare services at 47%. Government should facilitate access but rely on private providers at 7%. And government should have no role in healthcare at 0%. Wankumbu, what do you feel your answer should be in this question?
Interesting, especially that I see a tie between option 1 and 2. I think this is quite interesting, especially that we'll be speaking to the to what our leaders and their commitment means to us. So for me, I feel that government should be the primary provider of healthcare.
Really, I think the government should regulate and sub healthcare services.
Yeah, so I see we already see a tie there.
Yeah. Okay, so based on that, how can we use the commitments made in New York, the language in the political declaration for advocacy around self-care? How can we use that?
Thanks so much for that, Luel. First of all, allow me to express my disappointment on the fact that self-care did not make it in the final political declaration, having been included in the draft, just like Priscilla has mentioned. So for me, I've expressed this disappointment because we are not so long ago, the world was hit by COVID-19. We lost our loved ones who were disturbed emotionally, mentally, and the lack of self-care really in the political declaration tells us that we have not learned the lessons from COVID-19, because we saw that when COVID-19 hit the world, most of the health services could not be accessed from the health facility. You could find that a lot of people could not access public health institutions because most of them were attending to quarantine centers. So really, that tells you to say we have not learned from COVID-19, and also not realizing the importance of self-care. But despite that, I do strongly feel that we can advocate for policies that advance self-care, because even in the political declaration, you find that some of the articles really speak to what we are trying to speak to when we are talking about self-care. So like Priscilla also mentioned, self-care is not taking away the health system. Self-care is an innovation that is supporting the health system. So for me, when you look at the political declaration and the language that has been used there, I feel that we can use data to support the effectiveness of self-care, as well as its inclusion in the universal health coverage, because self-care and its objectives include things that are going to help us reduce the burden on the health system. Most of the people that may be joining here would be wondering what self-care is trying to do. Self-care is an innovative approach that wants to empower and equip citizens or people in the community with information so that they can have or live with good health lifestyle with little or no support from health providers. So when you look at the UHC political declaration, it speaks to patient empowerment. So if patients or people in the communities are empowered with information, then we are going to ensure and see that things that most of the health providers could have looked at, they are going to look at and focus on more critical conditions such as the non-communicable diseases, among other critical conditions. So really in that, it tells you that we need to empower people. Self-care, even the project that I'm on here back home in Zambia, is self-care. And what we are doing in the community as well, when we go out to the community health workers, the peer educators in the community, we are empowering young people aged between 10 to 24 with information so that they know how to take care of their own lives. So for me, I feel that we should ensure that people with information across all life cycles, because you find that the young people are having difficulties in accessing SRH commodities, HIV self-test kits, okay? And if, for example, when you look at just the lack of these commodities, the stockhouse of these commodities, such as the self-test kit, when you look at its importance, it will tell you that for us to achieve the UN global goals of 95, it just starts from supplying commodities like self-test kit, because they are going to allow and empower young people to test themselves in a discreet manner. And when they know their HIV status, then they are going to ensure that they are put on ART and eventually reduce their vital load. Well, you are the U equals to U champion. So, and it just something that young people should learn from you. And lastly, while I'm at this question, allow me to just mention that when you look at the political declaration, those of you that have the UHC political declaration in Article 48 of the political declaration, our political leaders have made a commitment, okay, that they want to ensure that no one is left behind. And they are also committing again that we should be able to reach the people in rural areas, the furthest people in the furthest points first, if we are going to attain the universal health coverage. And this is what our political leaders have committed in Article 88. But my observation and concern, even when the Article 48 speaks to providing physical and mental health, is that while maybe in developed countries they may have facilities or institutions that are able to address mental health. In developing countries like Zambia, you find that mental health is really a challenge. We do not have well or qualified trained therapists. We do not have psychosocial counselors. We do not have institutions or facilities for rehabilitation. Those that we have is a combination of conditions, and there's a lot of stigma and discrimination which is associated. For example, here in Zambia, we have a facility called Chainama Hospital. And when you are taken there, people will just say, no, that person is mad. But mental health is a problem that I may have, maybe because my girlfriend has disappointed me or she's not picking my call, I'll end up being disturbed and whatnot. But we are not taking care of the little things. So for us, under self-care and the project that we are implementing, the Youth Care Project, we are trying to ensure that we equip the young people. And I'm happy that even the political leaders are expressing these views that we need to ensure that no one is left behind. And if we have to leave no one behind, we need to share information, we need to provide commodities. And this is the language that is in the political declaration. So it is just disappointing, like I mentioned at the start, that self-care was not included, because these are some of the things that we are trying to speak to when we are speaking about self-care.
Oh, thank you so much, Nkumbu, for that. And, you know, while you're at it, there's something you mentioned about switching the advocating policy, right? But, you know, I would also need for you to help us understand how can we address the concerns of policymakers on self-care? How can we be able to do that?
Yeah, thanks. That's interesting. When you look at these concerns and why self-care was left out in the political declaration, it starts from the lack of the know-how. Our political leaders, most of them do not understand what self-care is. And when you look at even why it was there in the first draft, in the final draft, it was removed because some had concerns thinking that maybe self-care is coming to take up the entire health system or an overhauls of some sort. But no, self-care is coming in as an innovation to support, to enhance this service provision, and also lessen the burden on the healthcare system. Okay, so I'll give you an example. In the political declaration, there is an indication there. Our political leaders acknowledge that 20 to 40% globally, 20 to 40% of resources is wasted in the inefficiencies of the health systems. Okay, so you can see that already if a lot of people are empowered with information, they are empowered with knowledge, some of these simple conditions that we go to the health facilities with can be dealt out or can be dealt with simply by knowing how to live healthy lifestyles. Yeah, because especially as men, we have got poor health-seeking behavior. But if you and I know and realize the importance of using a condom, okay? We are not going to talk about an STI, okay? So these are some of the simple things that mean a lot when we are speaking to self-care. So coming to your question on how we can address some of these concerns, I feel that we may just need to ensure that the concerns that policymakers raised are addressed by, one, providing evidence-based data. I've just given you an example of the evidence that even which the political leaders indicated in the political declaration of 20 to 40% of health resources being wasted. So if we provide evidence-based data on the importance of self-care, you'll see that we are going to deal with a lot of issues. Yeah, we can use an example of COVID-19. We can document stories of how people in the communities could not access basic health services simply because most of the health facilities were turned into quarantine centers. Okay, so such evidence and statistics on the importance of promoting self-care then can speak to what our political leaders are concerned about. We need to ensure we sit and dialogue with them by addressing some of these concerns, such as telling them and letting them know that self-care is really an innovation that is empowering a lot of young people with information and knowledge. So if we are going to address some of these concerns, really we need to look at that. But lastly, we need to ensure that we document the success stories for countries like Zambia, Kenya, and Tanzania, where the youth care project, for example, is being implemented. We need to document the success stories. We can show a video like we had shown on this call, how young people, facilities, and communities have benefited from self-care. And on this, we can show how young people are putting we are empowering them with information to put their lives and live health lifestyle. So I think for me, that's what I can say when you talk about how we can address some of these concerns.
Right. All right. Thank you so much. And that has been, taken open my eye, right? And, from the chat section, the comment section, I am seeing that, you have received some really great comments where, we have, if I can read a few, and very good how you mentioned very concrete entry points from the Universal Health Coverage Declaration for self-care and advocacy. And we also have, so glad you talked about mental health, an area so neglected and yet so important. We have great submission and, just those are some of the comments that we have received from your input, Nwankumbu. And also we have reached a point where we have to ask you, our viewers, if you have any questions that you might have for our speakers today, this is the right time. And so I would implore you to kindly have your questions in the chat box or the comment section down below. And I'm going to get my speakers to be able to tackle your questions in the best way possible. Okay. Yeah, I've seen Nwankumbu with a pen and paper, so he's ready. He's ready, guys. Make sure to ask the questions. Don't let that paper go to waste. We're conserving environment. Okay, so this is your opportunity, guys, folks, rather. So if you have any question or any comment that you might have for our speakers today, Priscilla as well, according to the Y+ Global Youth Statement, which was presented at the high-level meeting in New York earlier a few months ago in September, yes. So if you also have questions on that, feel free to raise them out to Priscilla as well, or to Elena, or to Nwankumbu. So I'm going to give around 2-3 minutes to get a response, or maybe let me go through the section. Going once, going twice. So if I see no questions, I believe that everyone understood what we were talking about. And I would ask a question, but I don't know anyone who would answer it. So, well, before we finish our conversation today, it would be uncouth of me if I don't let my speakers today give us, we have heard conversations about what was missing in the high-level meeting and what we would want to happen or to see. So now, as a takeaway to both Nwankumbu, Priscilla, and Elena, for the next high-level meeting on universal health coverage, which is in 2027, what do you hope to see by then? Elena, do you want to start us off? Alina?
Maybe I can go.
Okay.
Okay, great. So I think for me, for the next universal health coverage high-level meeting, it should be 2027, right? Yeah, thank you so much for that. Yeah, so I think for me, I strongly believe that the collaborations, engagements such as this from the Trailblazer Group, AIDS funds, and other key stakeholders putting all this together, continuous advocacy and dialogue with our political leaders, I feel that already people will be able to understand fully what self-care is and understand that self-care is not coming to work in silos, or it's coming to take over an overhaul of the health system. So from all the key stakeholders, it's essential to ensure that the inclusion of self-care in the universal health coverage is adequately addressed in the next UHC high-level meeting. And also my knowledge and appreciation of self-care clearly indicates that for us to achieve universal health coverage by 2030, we need to embrace the innovation solutions such as self-care within our health systems. Let's work together to make this vision become a reality. And at the end, I say, my health, my responsibility. It is your duty to ensure that we have self-care included in the universal health coverage by continuous dialogue and advocacy with our in-country leaders and duty bearers. Thank you.
Awesome. Fantastic. That's amazing, Wankumu. Thank you so much. And I also want to say that because I know my health is my responsibility and my priority. And yes, dialogues are going to be the way to change that. Priscilla? Priscilla?
Yeah.
Hello?
Yeah.
Okay,
Yeah.
what would you want? Yeah,
Yeah.
sure.
Thank you. So I think what's his name? Wankumbu has said it all, but most importantly, I would like to just add that we should use the platforms that we have. We shouldn't think because we do not have maybe a high-level organization that we belong to, we can't speak out about these issues. Regardless of where you find yourself, there are avenues that you can make sure your voices are heard at the end of the day. So it is important that we make use of these avenues. I think the upcoming ICASA is a great opportunity to advocate for self-care. It is a really, really great opportunity as you go there and you encourage or you interact with stakeholders from all walks of life. It is a great opportunity to let people know what self-care is, why it should have been included, and its importance to the overall achievement of the SDGs, and UHC at the end. So I think we should make use of all avenues, and we should not limit ourselves. We should be as active as we can, show youth leadership all throughout, and be voices for the vulnerable when they are not in certain spaces. So that is all I have to say. Thank you very much.
Fantastic. Thank you so much. And to everyone attending ICASA, do make sure to spread the self-care messages out there. I'll be attending, but virtually, not physically, virtually. So I'm going to do my part and you do yours as well. All right. And last but not least, we do have Alina. Alina, what would you want to see in the next high-level meeting on universal health coverage in 2027? Hello, Alina. We're together. Okay, looks like she might be having technical difficulties. In the meantime, don't worry, I still have one more surprise for you guys, okay? So from our panelists or speakers today and the questions and what we've engaged with on universal health coverage and self-care, we have a Mentimeter. We have a Mentimeter for you, and we're gonna ask you. Yeah, yeah, we do have a Mentimeter. So that's our Mentimeter. You can either scan the barcode on the bottom left of your screen, or you can be able to go to menti.com and enter the code 29776. 2907776. And the link is also posted in the chat box below. So you can be able to head over to the menti.com and join in, where we're going to be asking a few questions, just a few, not going to be so harsh. Yeah, I am keying in my details right now. So you can either scan the barcode on the bottom left of your screen, or you can go to menti.com and enter the code 2907776, and we're going to ask the questions from there. So the first question, oh wait, do you have the question down? List down your recommendations and ideas on universal health coverage on the next page. I see we already have. Okay. Yeah, what are some of your recommendations for successful self-care advocacy? We are waiting for your responses. I am keying mine in right now. Oof, yeah, fantastic. Thank you so much for your answers. It should be based on real situations, real life stories. We make use of social media. It helps. It really, really does. It should be youth-led. It really, really should. Continuous advocacy and inclusivity. Sure, from what Alina mentioned also on the queer community, facing disparities, for young adolescent women trying to access abortion, post-abortion care is a challenge. So yeah, we need to be inclusive about the messages. In-country focused dialogues and conversations, creating awareness of the importance of self-care, fantastic. Tailored, smart advocacy for specific policies, funding at all levels, local, country, regional, global. Trainings and sensitizations. Awesome. Your answers are really, really well put into consideration. And those are fantastic, fantastic answers. Thank you so much for that. Thank you so much. Thank you so much for that. Keep them coming in. Keep them coming in. What are the recommendations for successful self-care advocacy? You can keep them coming in. Should be youth-centered. Must be driven by data. Yes, Wankumbo did mention on evidence-based information or data. So yeah, that's something that we can be able to focus on. So if we are exhausting our options, can we move on to the second question, please? Sure. What are your self-care priorities? What is your self-care priorities? Mine could probably be eating ice cream. Yeah, but that's not healthy in the long run, right? So what are your self-care priorities? E.g., accessibility of HIV self-tests, reducing cost of PrEP, developing national level self-care guidelines. So what are your recommendations for self-care priorities? What are your self-care priorities? Mine would have to be sure. I just inputted my priority. We do have reduced cost of PrEP or Dapivirine ring. Fantastic. Thank you so much for mentioning the Dapivirine ring. Accessibility of HIV self-test and PrEP for adolescents and young people, adolescents to antiretroviral medication, adequate antiretroviral treatment in health facility, exercising, access to HIV self-tests, digital health, commodity availability and affordability. Fantastic. Thank you so much for your responses. Access to PrEP for free without a lot of questioning. Thank you so much for your responses. Those are some of the priorities that we need to think about. Political leaders understanding and prioritizing self-care. Thank you so much. Health literacy, fantastic. It must be driven by data, accessibility, acceptability. Sure, I can see I have to move in closer. But yeah, thank you so much for your questions, for your answers, rather. Those are really, really inspiring answers, for priorities when it comes to self-care. And self-care sometimes, it's the simple things that we have to do, like, exercising, running, eating healthy. Those are some aspects of self-care aside from health when it comes to the social aspect as well. So those are, conversation that we need to put into consideration as we are talking about self-care and, advocating for it. So I'm pretty sure we can move on to the next slide. Oh yeah, we do have information on self-care options. Knowing what is there in your environment. Fantastic. Medical abortion services. Thank you so much for that. That's really, really inspiring, and having to understand what priorities mean for young people. And these are the things that we want to see come the next high-level meeting on universal health care. Can we proceed to the next slide, please? Awesome. What opportunities exist for self-care in your context? Right. What opportunities exist for self-care in your context? What do you think exists? What opportunities do you have for self-care that exist in your context? Is it physical self-care? Regular exercising, is it emotional self-care, mental self-care, spiritual self-care, professional and financial self-care, environmental self-care, digital and information self-care, community and civic engagement self-care, is it volunteering, right? We have an awesome toolkit on SRHR self-care. Oh, link will be shared. Fantastic. Yes, we do have a link for that. We do have yeah, the link, the toolkit will be shared. High demand for SMA. What does SMA mean? I honestly, I'm very bad with abbreviations, so I don't understand what SMA is, but yeah, sure, that's whatever you said. Or self-managed abortion. Thank you so much for that. I rarely understand what abbreviations mean. I'm a huge advocate of using the entire word, so thank you so much. Mental self-care, available antiretroviral treatment. Thank you so much. So please provide, what in your context, what opportunities exist for self-care in your context. Support groups. Thank you so much for mentioning support groups, because that, is something that is slowly, it's a dying culture, and we need to revive it back, because we need support groups, man. We sure do need support groups. Availability of self-test kits, self-injectables for contraceptives. Oh, that's really interesting. That's really, really nice. I only know the injectable PrEP. Yes, you can talk about what you meant with a contraceptive, but that's really, really nice. Self-injectable for contraceptions, comprehensive information online. Fantastic. Those are some of the opportunities that exist for self-care according to you guys, and keep your answers coming. Remember, this is a perfect opportunity. If you have a question, do leave it in the comment section for our panelists and for our speakers to be able to understand. And if you're just joining us, this is the Self-Care Learning and Discovery Series 2023, from the UN Political Declaration to country-level implementation on how to ensure universal health coverage. Global commitments lead to scaling up of self-care. So here is where we are at the Mentimeter, and we are talking about the opportunities that are present for self-care in our context. And I see antenatal care, thank you so much, and national level care guidelines in some countries, but need to be funded heavily on that, right? Heavily on that. And, with that team, folks, guys, everyone, I would love to say that we have successfully come to the end of, we have successfully come to the end of our conversations, but this is not an exam, guys, and it's not a class, okay? But I'm going to have you look at the Global Youth Statement, on self-care and universal health studies, self-care toolkit on SRHR and HIV for young people. And with that brings us to the last poll of the day. Yes, we do have one last poll. I am really sorry. I don't want to make it hard for you, but let's have the last poll. And this is very interesting because the poll is, how best would you like to receive information on self-care and universal health coverage? Again, how best would you like to receive information on self-care and universal health coverage? Is it podcasts, webinars, pamphlets, or which one do you think would be the best for submitting, understanding information? I would go with every one of them. Personally, me too, Priscilla, me too. I wish I would select all of them, right? I would have to pick one. I understand your pain too, Elisane. I really, really do. I would want to get the information from all over this media, levels or media, mediums. Yeah, media mediums, sure, right? And, keep your answers coming in, guys. Yes, for the last time, I'm going to ask if we have any question that you feel is pressing and needs to be answered. This is the perfect opportunity to ask for that. And, form these conversations. Yes, here are answers. Webinars. Webinar takes the flow with 69%, then podcasts with 15%, pamphlets with 8%, and conferences with 8%. So webinars, take it home, take it away. Webinars are the best way in our context on how best we would like to receive information on self-care and universal health coverage. So thank you so much, guys, for putting in your votes. And I have been your host, Ruel Okeo. I want to thank our supporters for having this session put into place. We do have AIDS funds, we have Y Plus Global, we have the Youth Care Partnership and Self-Care Trailblazer Group, who have managed to put all of this together. And so thank you to you guys who have been watching us for the past 1 hour and getting to learn and getting to understand more about universal healthcare coverage. So thank you so much, team. And in our country, we say kwaheri, I say goodbye, adios, obrigada, asante sana. Thank you so much. So until next time, bye.
Thank you.
Thank you so much.
Thank you. Bye.
Bye.
Bye. Stay safe.
Thank you very much.
Thank you so much. Bye.